The benefits of lymphatic drainage for rheumatoid arthritis. Manual lymphatic drainage massage, MLD, is exceptionally beneficial for individuals with rheumatoid arthritis, as it specifically targets a major symptom of the condition: inflammation. Rheumatoid arthritis is characterized by chronic inflammation that leads to joint pain, swelling, and decreased mobility. This occurs because the immune system mistakenly attacks the body's own tissues, particularly the synovium, which is the lining of the membrane surrounding the joints. This autoimmune response results in inflammation that can cause joint pain, swelling, and eventually damage the joint structures. How lymphatic drainage massage helps MLD is particularly effective in managing rheumatoid arthritis by reducing fluid retention in the joints, thus decreasing inflammation. This specialized technique stimulates the lymphatic vessels, enhancing the removal of lymph fluid that carries inflammatory substances away from the joints, aiding symptom management. Understanding the process. The lymphatic system. Comprising lymph nodes, lymph vessels, and lymph fluid, the lymphatic system relies on natural muscle and joint movements to propel lymph fluids, making lymphatic drainage massage effective. Technique of lymphatic drainage massage. This massage uses light, rhythmic movements that trace the path of the lymphatic system. Gentle pressure is applied because the lymph vessels are located just beneath the skin, helping guide the lymph toward the lymph nodes, where harmful bacteria and toxins are neutralized. Benefits of the massage. The massage promotes the movement of lymph fluids, which assists in the removal of inflammatory substances and toxins from the body's tissues. Key for managing conditions like rheumatoid arthritis. Regular benefits. Regular lymphatic drainage can significantly reduce joint swelling and improve mobility by continuously clearing out inflammatory substances. This contributes to maintaining fluid balance, detoxifying the body, and promoting a healthy immune system. Incorporating lymphatic drainage into rheumatoid arthritis management. While lymphatic drainage offers several potential benefits for rheumatoid arthritis, it should be integrated into a comprehensive treatment plan. Individuals with rheumatoid arthritis should work with their doctors and a lymphatic drainage therapist, and also consider regular exercise, nutrition, stress management, and necessary medication. Recommended number of sessions. The number of lymphatic drainage sessions needed can vary based on individual needs, symptom severity, and treatment response. Typically, a session can increase lymph flow from a baseline of 10-12 beats per minute, BPM, to 100-120 BPM, with effects diminishing over 48 hours. Thus, sessions may be more frequent than typical myotherapy or remedial massage sessions. Broader applications research suggests that lymphatic drainage may also benefit individuals with conditions such as lymphedema, fibromyalgia, and post-surgical swelling. To read more about lymphatic drainage and its benefits for rheumatoid arthritis, please visit www.myofitness.com.au.